Good morning. Thank you everyone for being here. I'm Carla Compton, the MLA for Tuxedo, as well as the Premier's Advisor on Nursing Culture and Safety and the co-chair of the Health Advisory Table. And I want to start off by saying, on behalf of our Manitoba government, we honor the sacredness of this land and of the ancestors that once walked here. The Anishinaabe, the Cree, the Dene, the Dakota, the Métis, the Inuit, and the Anishinaabe nations who paved the way for what is now known as Manitoba, home to all treaty people. As a nurse who is proud to work in our public healthcare system, today's announcement goes a long way towards strengthening public healthcare, supporting nurses working on the front lines, and getting everyone the care they need. And it's an honor to be joined by the Minister of Health, Seniors, and Long-Term Care, and the Deputy Premier, Uzoma Asagwara, and the Manitoba Nurses Union President, Darlene Jackson. To speak more about this announcement, I'll invite Minister Asagwara to share a few words.
Thank you so much, Carla, and thank you everyone for being here today. Thank you, Darlene, for joining us. Hope you're okay. You've got some water?
Yeah,
okay.
I do.
All right. So we know that healthcare staffing is at the very heart of the challenges that we're seeing across our healthcare system and the challenges we've been seeing for some time. And our government has been doing the heavy lifting and the work alongside MNU, frontline healthcare workers, and many folks, partners across the system to move us in a better direction. We recently announced that we added more than 873 net new healthcare workers to the front lines of our healthcare system. And that was an objective, a target that was set out in our last budget. And we know that more than 300 of those healthcare workers are nurses. But we also know we have to keep going because the previous government's cuts and, quite frankly, their disrespect of healthcare workers, their approach for 7.5 years did a tremendous amount of damage. They essentially, through their cuts and their mismanagement of the healthcare system, created a cottage industry of private for-profit agencies that have really exploited the healthcare system and the frontline healthcare workers who are powering the healthcare system. And this is something that's happening right across the country, right across Canada. For-profit companies are charging exorbitant amounts of money. In our case here in Manitoba, charging 6 times the rate of a nurse in the public system. They're squeezing the public system for millions and millions of dollars in travel fees, mileage rates, and per diems. This is all money that can and should be spent on the front lines of the public healthcare system. And frankly, for-profit nursing agencies have really turned the healthcare system and staffing into a quest for the highest bidder. And ultimately, it's the patients, it's frontline healthcare workers who suffer. Because while for-profit agencies, for-profit companies are raking in record profits and revenues, frontline nurses are stuck in this cycle of mandatory overtime and burnout. And we hear from nurses regularly that they see this happening on the front lines, and that does not sit well with these nurses. While public system nurses are missing family dinners, they're missing soccer games, and they're covering vacancies, agencies are creating this self-fulfilling prophecy here in our province. The more that facilities, the more that regional health authorities are leaning on these for-profit agencies, the more public system nurses are burning out and leaving the system. Private agencies, fundamentally in the province, while we recognize there's a role for them, are contributing to the system being a harder place in some cases for nurses. It's making it harder for the system to work in the best ways possible on the public side. And so with all of that being said, we understand and we've seen in recent years especially why nurses moved away from the public system. They endured years, 7.5 years of cuts to healthcare by the previous government, of their voices not being heard, of consistent disrespect by previous PC health ministers and previous PC premiers. They went years without a fair contract, years of frustration that went unheard and ignored. I know that many nurses left the public system looking for flexibility. They were looking for a way to manage their work-life balance. And they were looking for autonomy, but most importantly, they were looking for the respect that they could not find and they would not find under Heather Stephenson and her government and her team. And so when we came into government, the Premier and I made a point of sitting down with these nurses. We made a point of getting to the table with nurses and hearing exactly what they had to say. We sat down at the table and made sure that they got a fair contract. We knew that this was one of the most critical steps in restoring the trust and repairing the respect with nurses across the province. And with the expertise of folks like Darlene Jackson with MNU, we were able to design a path back to the public healthcare system for these very nurses, a path out of the never-ending cycle that had been perpetuated by the for-profit private agency use. And we have been welcoming back nurses to the public system. We've taken steps to protect their seniority, to protect them in their workplaces, and to simplify their licensing pathways. And we've given them the freedom to negotiate a fair deal, and that was huge. We gave a special incentive to work full-time. This is something for nurses across the board so that they can start to, and we can start to climb out of this healthcare staffing challenge that we've been facing for years. Again, all of this work that we've been doing in partnership with the folks on the front lines, with frontline nurses, with Manitoba Nurses Union, with our partners across the healthcare system. We've even taken steps, which is significant, like expanding the travel nurse team, a really wonderful tool in the public system. This is the public system's response to agencies. This is something that has given nurses tremendous flexibility. It's given them back a great quality of work-life balance and autonomy, the autonomy that they have been looking for. All of that in a travel nurse team in the public healthcare system. We've empowered health authorities to hold nursing agencies accountable, which was a very important step. And we demand that highly skilled nurses are filling the jobs that we need to fill. We took an extra step as well. We even banned health authorities from signing any new agreements with agencies in Manitoba. That was an important step for us to take because we have seen this rapid increase of agencies popping up in Manitoba. And so today we're here to announce that we're going a step further. We're taking that next big, important step, and that we are going to be issuing proposals and receiving proposals, rather, for agencies that actually wish to contract with health authorities here in Manitoba. So the RFP will be going out. And this RFP will set a limit on the number of agencies that Manitoba contracts with. It will set parameters for how those agencies assign staff, they respect seniority, and deliver patient care. Here in Manitoba, there are hundreds of contracts with more than 70 private for-profit agencies. There are no policies on how those agencies should be governed, their impacts on nurses, or the rates that they charge, and this RFP will change that. It's going to require agencies that want to hold a contract with Manitoba to play by our rules. As a government, we're preparing for the next fiscal update, and it's been clear for quite some time that agency use is a driving factor of the healthcare sector that runs over budget every year without improving health outcomes, and that is unacceptable. We have to get a handle on agencies. We have to get a handle on agencies that are charging Manitobans for the healthcare that they deserve. It's the responsible thing to do when it comes to our books, and it's the right thing to do when it comes to patient care. The use of private for-profit agencies will still be, as I said, a reality here in Manitoba, but with this RFP, we are going to transform the way that we use agencies. We're going to shift it from the default to the exception. And it's going to start to take the pressure off the front lines and move us in a direction that's going to help us achieve our commitment to reduce mandatory overtime for nurses and the rates that we know directly impact patients. And this is going to mean better care for Manitobans who are accessing care in our hospitals and sites across the province. So this is an example of how our government is teaming up with Darlene Jackson and her team at the Manitoba Nurses Union to change the culture in healthcare. We're bringing the system back to the principle that the further away you get from the bedside, the worse the decision-making tends to become. And we're putting the emphasis back on patients, back to the front lines, and back to the healthcare that's there for you, not there for the highest bidder. And so now I'll invite Darlene Jackson to share a few words about the RFP and how it's going to benefit nurses. Thanks.
Thank you. And thank you for the opportunity to speak today on behalf of Manitoba nurses. This announcement represents a positive step towards addressing a critical issue in our healthcare system. For too long, we've seen resources drained into private for-profit agencies, money that could be far better invested in strengthening our public healthcare system. Redirecting these funds into our public healthcare system supports nurses in permanent positions within the public system, and it's very fiscally responsible. But it's also essential for assuring better care for patients and better work environments for nurses. The current over-reliance on private agencies creates numerous challenges. Without quality control measures or provincial standards, there is no consistency in patient care, no safeguards on fair wages, and no protection against excessive hours that lead to burnout. Nurses are the backbone of the healthcare system, and they deserve stability, respect, and the assurance that their hard work is valued appropriately. But this isn't just about nurses. It's about patient care too. When agencies prioritize profit over care, it's the patients who pay the ultimate price. Quality and continuity of care suffer when nurses are forced to work without proper support or resources. Today's announcement is a step towards putting patients and nurses first by reducing the dependency on agencies and ensuring our healthcare dollars go where they are needed most to improve healthcare, create better working conditions for our frontline staff in the public system. We're hopeful that this RFP will help us begin to regain control of the health human resources available. Manitoba nurses are ready to continue delivering the excellent care Manitobans deserve. Together, we can build a stronger, more sustainable healthcare system. Thank you.
Thank you so much, Darlene. Really appreciate your words and really appreciate your partnership in being able to do this work and get to a point where we take this really important step for Manitobans, for patients and for nurses and those on the front lines. And so now we'll open it up for any questions that folks might have.
So can you tell us about how many contracts there are right now and how much longer they're in place for? Because I know RHAs have different ones with different agencies.
Yeah.
What's the status of the contracts that are in place already?
So there are over 70 existing contracts that are in place right now. As I stated months ago, we actually took the step of saying no more new contracts, that no regional health authorities could sign any new contracts with vendors, with for-profit private agencies. We've seen that agencies are just popping up everywhere, and there are no controls, there's no expectations on how they make sure that the right nurses are being sent to the right places. And so, this step today is really important. It's sending a clear message to agencies that we are prioritizing patient care, we're prioritizing strengthening the public system. We've got the tools in place to make sure that nurses have the opportunities to have a better work-life balance, fair compensation, competitive packages. And so we know that there are some really good agencies out there who want to be a part of the solution and want to make sure they're providing quality patient care. And we're happy to work with those folks with having strong guardrails and guidelines and finally some controls in place that we should have, quite frankly, had in place a long time ago.
When do the existing contracts expire, though, with the RHAs and the private agency nurses? Like, can you give us a range or idea?
Sure. So this RFP process is going to, it's going to be underway essentially immediately. It's going to allow for agencies to bring their names forward and compete in that RFP process. And we're going to go through that process, select the appropriate proponents, and go from there. So there are existing agency contracts right now. We've been very clear working with regional health authorities to make sure that they are working hard to have better practices in terms of how they utilize the existing agencies. But this RFP is moving us in the direction of making sure that we have clear parameters, controls, we're managing our costs in a much more responsible and sustainable way, and we're prioritizing quality patient care. And so it's going to take us a little bit of time to get to the place where we have, a set number of agencies, and we're working with quality partners who understand the importance of taking this approach, but we're on our way to getting there.
Do these agencies have long-term contracts with RHAs, though? Like, I'm thinking, when are they going to start to expire? This year, the end of this year, next year? Do you know when those the existing contracts are up?
Oh, sure. That's a great question, Carol. This RFP process is going to ensure that all regional health authorities are working with the proponents that are selected through this process. and follow and adhere to that process. So the existing arrangements that they have right now will not be in place. We are issuing this RFP process to make sure that we are only working with for-profit private agencies that are good partners in this process, that we're all working and rowing in the same direction of making sure that we're strengthening the public healthcare system, that we're supportive of nurses working in ways that work for them, but that we're all on the same page, that we're prioritizing the healthcare of Manitobans. That quality patient care is the priority, and that we have a healthcare system that is sustainable, and that we're taking a fiscally responsible approach, which is what Manitobans expect from their government.
So sorry, the existing contracts will be canceled?
This RFP process is going to ensure there are contracts in place with proponents who compete for that process. From what I've heard from agencies, is that a lot of folks have been asking for this. They want controls in place. They want to make sure that the right agencies have contracts with regional health authorities and with government to deliver quality care to Manitobans. I've had conversations with folks who have identified that there are some really problematic practices out there and that they don't want to see that. They want to be part of the solution. This is an opportunity for those agencies to be part of the solution, for those agencies who want to be a part of making sure our healthcare system is working in a sustainable way and supporting nurses in the right ways, that they have the opportunity to be a part of the RFP process and have those contracts available to them.
Sorry, I still don't understand if the contracts will be canceled when the RFP is issued. Like the existing contracts, are they?
I see what you're asking, Carol. Thank you. No, the contracts that are existing right now will continue. Those relationships will continue. The RFP process is going to take time, right? So we're not canceling those contracts overnight and then going to the RFP process and waiting. Again, as I said earlier, agencies have a role to play. And so we're going to do this in a responsible way. We're doing this in a methodical manner to make sure that we're not disrupting the healthcare system. Our priority is making sure that nurses have stability, that patients have stability and have quality patient care and are safe. And so we're doing this process in a manner and with our partner in Manitoba Nurses Union so that we can support a stronger healthcare system. And, these aren't changes that are going to happen overnight, but these are changes that are going to happen. They're necessary, they're long overdue, and it's going to make healthcare stronger.
How much is the province on track for spending on private agency nursing right now?
Too much. We're on track to spend too much on for-profit agencies. We spend far too much of Manitobans' money on for-profit agency nurses. We do. It is an approach that is not sustainable. It's not a responsible approach. It's an approach that was unmitigated and ignored for years under the previous PC government. We had 7.5 years of a conservative government that cut the public healthcare system, disrespected nurses, and drove them out of the public healthcare system, all the while putting zero controls in place for agencies that saw this as an opportunity to stand up their businesses and make millions of dollars in profit. And now what we're saying is, as a government, we have a responsibility to make sure that we are doing our due diligence, working with our partners to understand what nurses' needs are. And we've been doing that work, which is why we've seen over 870 net new healthcare workers on the front lines of our healthcare system. Over 300 of those workers are nurses, but there's more to do. This RFP process is another big step. It's about strengthening the healthcare system. It's about making sure we're taking a responsible approach. And I'm confident that we're going to have agencies that are willing and wanting to be a part of this process and making healthcare stronger and doing that in a responsible and sustainable way.
In an op-ed that Darlene Jackson co-wrote, it was $60 million. That was the last count. Are we more or less than 60 million now? Is that accurate? What? Sure.
So we know that in the 23-24 fiscal year, we spent, public sector employers spent $77.5 million, which is 40% more than the previous fiscal year. And from our numbers we're seeing, we're tracking to be even higher than that in this fiscal year. So those numbers are growing every year by absolutely unacceptable percentages. So we clearly are heading in a direction where we have facilities that are totally staffed by agency nurses, and we really need to get nurses back into the public system. And hopefully with the provincial travel nurse team, we'll be able to achieve that with this RFP.
Do you have any numbers for the float pool and for the travel nurse team?
Mm-hmm. So we know that we've been able to recruit back to the public system through the float pool over 170 nurses, and we are onboarding more and more nurses all the time. This is a really wonderful tool that is unique to Manitoba that gives nurses that competitive offer of the flexibility, scheduling, work-life balance, being able to pick up where they'd like to work and get experience and contribute to their benefits. That's something that is absolutely not available working in agency. They also have peer support, mentorship, access to resources that they absolutely won't have through agency. So it's a really wonderful tool that we have in Manitoba, something other jurisdictions are a little jealous of, and that's a good thing for us as a province. But again, this is something that we're dealing with that has gone unchecked for many years, right? So the train left the station years ago when it comes to for-profit agency use, and the previous PC government did nothing to slow it down. And so the numbers that we're seeing in terms of spending are far too high. We've taken real steps to strengthen the public system and encourage nurses to return to the public sector. And I know that no matter where nurses are working, they're doing their best to provide quality care. They want patients to have the best care. They just need, leaders and a government that they know have their back in the public system, and they have that now. This step is making sure that we finally do the work the previous government refused to do, change the trajectory of the use of private for-profit agencies. And we're going to see the benefits of that, but it's going to take us a little bit of time to get there. But the only way that we're going to get there is by taking this really important step with our partners and making sure that we're working with proponents across the system to move this in the right direction.
When do you expect to get there? When do you expect the RFP will be ready for its rollout?
We are going to be issuing the RFP right away. This is something that we've been working hard to get stood up and do in the right way and make sure that our partners are happy with what it looks like and that we all agree this is the direction that we need to go as a province. It's going to take us time to get through the RFP process. As folks well know, those things take a little bit of time, but we're doing this in a responsible way where we've already been signaling and we've taken very clear steps in terms of mitigating the use of any further agencies and working with our regional health authorities for them to change their practices, quite frankly, and not treating agencies as the default, and that they need to start treating agencies as the exception. And so there's more work to do, but the RFP process is a big step in the right direction for that.
Can you provide any examples of private agency nurses where there were no policies or procedures and just an idea of how they've been draining the public purse to, enrich themselves? I don't know. Are you talking about people who've become millionaires? I don't know. Can you give us an example of how this is?
Well, we know that agencies are making millions of dollars because we see it every year in our expenditures, right? We're spending far too much money on for-profit agencies. We know, and I've heard concerns around agencies who don't do their due diligence to make sure they're sending the right nurse to the right site for the right work. And so this is really important in terms of putting clear controls in place to make sure that the public knows that the nurses that are at the bedside are the right nurses with the right skills. And, to this point, we've been doing this work with MNU to get to this point. We've been listening to nurses who brought forward their concerns, agency nurses included. And this is something that we've heard loud and clear is desired by nurses on the front lines, by employers, by the union, by government. And so we're all working together to take this really necessary step.
So the RFP will be issued in the new year, and the process will take until spring? I don't know. Can you give us an idea of
I can get you maybe a tighter timeline offline on that. Yeah.
I have a question about the supervised consumption site.
Sure.
Why did you choose the location in Disraeli?
Well, we know that that's a location that has a lot of community-based resources already. So that particular area in core Winnipeg, which is really close to my constituency of Union Station, has a number of agencies that deliver primary care, agencies that are Indigenous-led, a lot of services right there that are providing, community-level, grassroots-level care every single day at all hours of the day for folks who need it. And we also know that that particular site has already stood up infrastructure that have healthcare providers, paramedics, for example, nurses, and community resources that can really meet communities' needs. So it's right in a part of the city where we know that there are some challenges around homelessness, severe and persistent maybe substance use, challenges around that. We know that there's community that exists there that really benefits from those services. And so I do think it's important when you stand up a supervised consumption site or any service that's meeting people where they're at, you actually establish it in a place that's meeting people where they're at.
Have you received any pushback from people in the community?
I think folks in the community are really open to this. They've been seeing these challenges for years, and what they want to see from their government is a compassionate, evidence-informed approach that brings primary care providers together, that brings experts to the community to meet people's needs. And so I think people are actually really excited that there's action finally being taken to make sure that those who are struggling with addictions and struggling maybe with acute health issues that can't get their needs met elsewhere are finally going to have their needs met in one location that's going to have dedicated teams and dedicated resources right there for them.
Best case scenario, when's it going to open?
That's a question better answered by Minister Smith, who's responsible for leading the work around the supervised consumption site. But what I can say is that her team and our government have been working very, very hard to stand this up as quickly as possible. Aboriginal Health and Wellness is a great organization that does fantastic work in our communities, and other partners are at the table contributing to this happening in the right ways, in a good way. And so, this is something that we look forward to sharing more information on right away with folks. We're going to go to Zoom now for questions.
Thank you, Minister. One reporter on the call, Michelle McDougall from the Brandon Sun. One question, one follow-up.
Good morning. Thank you for taking my call. As we know, a lot of nurses went to agencies because of work-life balance and more money. And I mean this in the possible best way. So will it be a hard sell to have, some of the nurses give up what they think they're giving up? Is that a clear question?
It's a very, very clear question. Thank you for it, Michelle. What I would say is that we fully understand and appreciate why nurses were leaving the public system under the previous government. They did not have their voices heard whatsoever. They were being fired from the public system. They were being treated with outright contempt at times by previous health ministers and by the previous Heather Stephenson government. And they couldn't even get to the table to negotiate a fair deal. We've worked really hard as a government to reset that relationship and to do the work of repairing and rebuilding trust and changing the culture. We got to the table to negotiate a fair deal. We've added more healthcare workers to the front lines. We've made it easier for nurses to have their licensing renewed and to return to the public system if they recently retired, which several nurses, many nurses did under the previous government. We've undertaken a listening tour where we've heard directly from nurses in their own communities, at their own sites on the front lines to hear their ideas. And we've actually been able to action the ideas that these nurses have brought forward. So we've done a lot of work, including staffing up the travel nurse team float pool to make sure that there are more and quicker opportunities for nurses to join that pathway, which really is very competitive in my personal opinion. I would say it's actually a stronger option, a better option than agency. Very competitive pay. You get compensation that is wonderful. It contributes to your full-time work if you're working full-time to get that incentive. You have mentorship, peer support. It contributes to your benefits. So we've really provided all of the things that nurses desire and what attracts them to agency. We've developed that in the public system. And now what we need to do is put some controls in place so that agencies that are exploiting the challenges that have existed in the system for years are finally, working with controls in place, and we're working with good partners that exist in agencies. So, Michelle, I understand your concern, definitely, and we're listening to nurses every day to hear if they have any concerns or ideas around this, but what we've heard loud and clear has been reflected in our actions and is reflected in taking this necessary step today. And we're confident that if we keep listening to nurses and working with them, that we're going to make sure the public system is the place they want to be.
Okay, and my follow-up, and if you could include me, I think it was Carol who asked about the timeline, include me in that. But my last question is, so you put out this call for request for proposals. What if you get 15 agencies who want to be part of it? How are you going to work that out? I guess that's a bit of a process question too.
Yeah, that's a great question. It is a process question. We are going to work with the best proponents who come forward. There's As I said, 70-plus agencies operating in Manitoba. That in and of itself is unsustainable, and it really dilutes the quality of agencies that you partner with, you contract with, and you work with. And it really gets in the way of making sure you have appropriate controls in place to make sure patient care is top-notch and where it needs to be, and that you're working with folks who understand, the importance of having a strong system that's working for the right reasons. So, this is an opportunity for those agencies that want to be a part of the solution and who understand the importance of putting patient care first, of making sure that nurses are safe, and that we are moving in the same direction as a healthcare system. This is a chance for those agencies to be a part of that. And we know those agencies exist. There's some really good agencies that recognize the importance of taking an appropriate approach. And this will, quite frankly, weed out the agencies who shouldn't have agencies in Manitoba. We know there are agencies like that exist. We know that there are agencies that are exploiting challenges in the healthcare system to their benefit, not trying to benefit patients and nurses on the front lines. And so this is an opportunity for the really good quality agencies to put their names forward and for us to work with them.
Thank you. That concludes the questions from Zoom. We'll turn things back to the press conference theater.
Were the agencies, any of the agencies here licensed, or were they required to be licensed to operate or to contract with RHAs and facilities?
So currently there are little to no controls in terms of agencies and what they need to have in place in order to stand up their business in Manitoba. This is a national problem. I know this is something that Darlene has had many conversations with folks across the country. I've had this conversation with other health ministers, other teams across the country. This is a very real problem across Canada. And here in Manitoba, we're saying enough is enough. We're saying that agencies must have controls in place. They must have parameters to follow that are outlined and dictated by government and the employer that prioritize patient safety and quality care, and that work for nurses as well. And so, this is an important step that I know there are many agencies who will be willing and excited for this opportunity, and we're looking forward to working with them.
Can you give us an idea of just some of the requirements that might be part of the RFP that agencies are must have in order to contract?
Yeah. So there's definitely going to be cost controls in place. We can't have these 6 and 7 times the cost of hiring nurses in the public system. We can't have that be something that continues to go on with agencies. We have to have controls in place in terms of making sure that nurses are practicing in safe ways. We need to make sure that patients can trust that nurses who are showing up to provide care are nurses with the right skills. And I say this as a psychiatric nurse, right? If I'm a psychiatric nurse working for agency and you want to send me to go and staff in an emergency room, that's a problem, right? That's not a good fit. It's not an appropriate fit. And so what we need is to have controls in place so that agencies are sending the right nurses to the right place to provide the right care. And this RFP process is going to do just that. And so, this is something Carla, as a nurse as well, she and I have talked about. It's a wonderful opportunity. This is a great step that we're taking as a province to make sure that nurses have the right kind of staffing model in their workplace in Manitoba, and that patients have a staffing model that really prioritizes their needs. So it's the right step and it's an important step, and we're looking forward to the outcome of the RFP process. Okay. Thanks, everybody. Thanks. Thanks, Carla.